today. My name is June Klein-Bacon, and I am with the Brain Injury Alliance of Iowa. Today's presentation is brought to you by the Iowa Department of Health and Human Services Public Health Division, the Brain Injury Alliance of Iowa, and is hosted by Every Step. Please note that this topic may include discussion about life events that may be difficult and not intended for all audiences. It may elicit emotions, reactions, or emotional responses. Before we get started, a couple of disclosures for us today are listed here on the screen. This presentation is supported by the Brain Injury Services Program in Iowa through a grant through the Department of Health and Human Services Administration for Community Living, AOD TBI Demonstration Grant. The contents are solely the responsibility of the authors and do not represent the official views of DHHS. This information is not a substitute for medical advice, diagnosis, or treatment. So today we're going to walk through a few different objectives. We are going to define adverse childhood experiences and the relationship between those and toxic stress and brain injury. We're going to talk about the connection of ACEs, adverse childhood experiences, toxic stress, and brain injury that are common among refugee and asylum seeker populations. We're going to talk briefly about the brain. We're going to talk a little bit about functions of the brain and talk with you about a few resources that are available for you. Adverse childhood experiences. This study was completed in the 1900s in the United States. This study examined the relationship between ACEs and the impact on adult health and behavior throughout the lifespan. Using questions about childhood trauma and current health status and behaviors combined with physical and mental health examinations. Participants were asked about 3 types of abuse, neglect, and household dysfunction. Participants were scored on their experiences and the number of experiences that they had with each category, but it did not measure the frequency or severity of those experiences. The ACE study showed that as the number of adverse childhood experiences rose, so did the risk of many health issues and mental health challenges. The general finding was that childhood experiences do literally shape who we become as adults. As we hold on to this information about ACEs, or again, adverse childhood experiences, it is important for us to reflect on those experiences as they may be a part of a migration journey. The World Health Organization Collaborating Center on Investment for Health and Well-Being reports 3 distinct phases: the pre-migration phase, the migration journey, and post-migration, where a refugee or asylum seeker may be exposed to adverse childhood experiences or toxic stress. Refugees and asylum seekers are at greater risk for toxic stress and brain injury. We know that there is greater risk before, during, and after the migration journey. We know also that traumatic brain injuries are commonly sustained by refugees. The incidence and prevalence of torture and traumatic brain injury is significant. Global Mental Health tells us that the overall prevalence rate for head injuries in this population is 51%. Now let's talk a little bit about toxic stress. Toxic stress can occur when a child or an adult experiences strong, frequent, or prolonged adversity, such as physical or emotional abuse, chronic neglect, caregiver substance use or abuse, mental illness, or exposure to violence. This can occur with or without adequate adult support or natural support system. This kind of prolonged activation of the stress response systems can disrupt the development of brain architecture and other organ systems and increase the risk for stress-related disease and cognitive impairment across the lifespan. Now, we spoke a bit about the ACEs study in the United States. The World Health Organization's International ACE questionnaire addresses some additional types of adverse experiences for refugees and asylum seekers. They added additional questions to recognize the witnessing of community violence, and exposure to war and collective violence, such as being forced to go live in another location due to that violence, destruction of one's home or community, and being at risk or witnessing individuals being killed by soldiers. The very nature of the life experiences of a refugee, witnessing violence may contribute to how toxic trauma can alter brain function or brain development. So, as we understand how trauma can impact brain function and development, it is important for us to understand the brain is our control center for our behavior, our emotions, our physicality, and our cognition. The middle part of the brain, as shown in this slide, is our limbic system, which is a set of structures of the brain and plays a leading role in our behavioral and emotional responses, especially behaviors linked to survival. Things like reproduction, caring for our young, our flight, fight, freeze, or fawn responses. This area of our brain supports regulation and response to emotional stimuli and is also involved in reinforcing behavior. Research shows us that trauma is processed and stored in our limbic system. So why is understanding the risk important? Because the outcome can impact the brain lifelong. Here you can see that the brain, again, is the control center of our cognitive, emotional, behavioral, and physical functions. Here are just some of the functions that our brain manages. This system is very complex, it's very interconnected, and gaining a basic understanding of how these functions are interconnected, bringing an understanding to brain injury that's caused by falls, assault, motor vehicle crashes, stroke, overdose, toxic stress, or maltreatment, among many other types of brain injuries, can cause permanent injury and permanent loss to functions described here. To give a little bit of a definition of brain injury and to dive just a little bit deeper, an acquired brain injury is not hereditary, is not congenital or degenerative. There are two different types of acquired brain injury. There is non-traumatic brain injury. This is about internal insults to the brain. So again, things like stroke, strangulation, overdose, things that may cause change in blood flow or oxygen flow. Traumatic brain injuries, which we hear more about and are more commonly placed when we think about brain injury, are going to be those alterations with the brain that are caused by external force. So again, I mentioned falls, motor vehicle crashes, assaults. Those can cause traumatic brain injury. It's important to note that concussion is a mild traumatic brain injury. So when we can think about the challenges or barriers related to brain function as a result of brain injury, that can provide us the opportunity to think about how to develop strategies or necessary accommodations to manage those functional changes. Let's discuss a couple of examples. When we think about the function of attention, we can see here that attention is divided into three different types. Understanding and diving deeper into the components of a function like attention can help us determine what kind of strategies we might develop, what kind of accommodations somebody might need to live their life as independently as possible. For example, we can pull out divided attention. If somebody is struggling with divided attention, we might see them have struggles in paying attention to one task if there are a lot of different stimuli around. So we might consider things like workspace, meeting spaces, engagement spaces to try to reduce visual and auditory distractions. We might use technology to keep us on task. Another example that we're going to talk about here is memory. There are three different types of memory that we can talk about. We can talk about short-term memory, working memory, and long-term memory. Understanding that if brain injury has impacted any of these types of memory, then this can lead us to strategies or tools to help someone be successful, such as learning how to keep important information in one location, keeping notes or reminders, or to develop routines to navigate tasks. I would note with any strategy development, just like for somebody without a brain injury, consistency and routine is important to build and strengthen neural pathways to learn a new skill or a new strategy. So, I do want to provide you some information on some nationally based resources that you may want to visit. These are nationally based resources that can lead you to organizations like mine at the Brain Injury Alliance of Iowa. There are state-specific resources that can provide you with educational materials, advocacy organizations, as well as resource facilitation, somebody to talk to and learn more about brain injury. Here you can see the websites for the United States Brain Injury Alliance, NASHA, the National Association of State Head Injury Administrators, and the Brain Injury Association of America. So while this time together has been brief and we've just touched on the surface of understanding adverse childhood experiences, toxic stress and brain injury, and how that may impact the refugee community, it's important to know our brain is incredibly complex, strong, dynamic, but at times fragile. So I encourage you to remember that everyone has a story. Thank you for joining us today.